Good morning. My name is Dr. Whitney. I'm a staff cardiologist at Wilford Hall Medical Center and the former project officer for the Air Force Care Program. What I'd like to do this morning is talk about obesity and its management. Now, it's kind of interesting. One of the most important things we need to know is the definition of ideal body weight. Ideal body weight is defined as the weight for height which is associated with the longest longevity. And this was actually discovered by the life insurance companies who sold life insurance to young and middle-aged men back in the 1920s and 30s. And they found out that the individuals who were on the thin side tended to live longer than individuals who were heavy. In point of fact, the average American is 20% above ideal body weight. Now, this slide shows you the increase in risk of developing cardiovascular disease and dying with increasing body weights above ideal body weight. And as you can see, if your weight is only 20% above ideal body weight, there's a small increase in risk of developing cardiovascular disease and dying. However, once your weight goes up to about 40% above ideal body weight, you'll notice that the risk increases by about a factor of 2. Now, at this stage in the game, the vast majority of people will be put on the Fat Boy program. As your weight increases further to 60% above body weight, the risk accelerates dramatically and there's a 4-fold increase in risk in dying ahead of schedule. I know a lot of people view the weight management program as an appearance program, to be the lean, mean fighting machine, but as a physician, I think that this program is really a health program, something designed to keep people healthy and productive, leading happy lives. Now, it's kind of interesting. How does increasing weight hurt you? Well, being overweight can hurt you several ways. The first is whenever any individual gains weight, the blood cholesterol tends to go up, and this will accelerate the atherosclerotic process. Furthermore, many people, when they gain weight, will have a reduction in their HDL cholesterol. This will reduce the body's ability to get rid of cholesterol from the walls of the arteries once it has been deposited. Furthermore, when weight is gained, blood triglycerides can increase, and this is an important risk factor for heart disease. Many individuals, when they gain weight, will have an increase in their blood pressure and become hypertensive. Many individuals can actually have their blood pressure treated simply by weight reduction. And further, some individuals become diabetic when they gain enough weight, and they can, in point of fact, treat their diabetes simply by reducing weight. Now, this cartoon just shows you the adverse effect that it can have on your heart if you just gain a few pounds. It can affect you in all these ways, and if all of them become out of whack, the impact on your cardiovascular health can be fairly dramatic. Now, it's kind of interesting. Why do we eat? Why do we get hungry? What actually goes on in our body? Well, everybody in their brain has a thermostat for eating. In other words, if you gain a weight above a certain level, your thermostat will turn off and will tell you not to eat. If you go hungry or without eating for a certain period of time, you'll lose weight, and then you'll feel like eating. And then if you really go a long time without eating, your body's thermostat will turn on and tell you, hey man, you're really hungry. You better eat like crazy. And if you don't watch it, you can go into a feeding frenzy and really put a lot of weight on. And this is why the vast majority of weight loss programs are so commercially effective in this country, because they are ineffective in maintaining weight loss. That is, if you take a look at Weight Watchers, you'll see that 98% of their business is repeat business. People who lose a little weight by restricting the amount of food they eat, they get hungry and they stay hungry for a couple of weeks, a couple of months, and then their brain just kicks in and says, feed me, I'm miserable. And then they eat their weight right back up to that set weight, and they gain their weight back, and guess what? They're back in Weight Watchers for another course of therapy. Again, this is why almost all of the weight loss programs that focus on just taking fewer bites and being hungry all the time are such commercial successes, because they're, medically speaking, failures, because they don't maintain weight loss. It's impossible for somebody to stay hungry all the time, year after year after year. Now, your appetite thermostat is a very interesting phenomenon. This thing is actually set by the end of puberty, and so if you look at this, children who are overweight as adolescents will have that weight set point very high in their brain, and they'll have to fight the battle of the bulge for the rest of their life. They'll never get over that. And this is why prevention in children is extremely important. Well, there's only a few things that can actually lower body weight, and one of these is stomach stretch. You know, if I took an individual and put a balloon in his stomach and blew up that balloon and left it blown up, that individual's appetite would go away, you know, until his stomach stretched up to make enough room to get food past that balloon. So stomach stretch is one of the important things that can reduce your appetite thermostat. Other things that can affect the appetite thermostat are exercise. If an individual increases his exercise, he will actually eat the same amount of food but burn up more energy and lose weight from this process. And this is an actual lowering of the appetite thermostat. Once an individual stops exercising, the thermostat goes right back up to its former level, and then you regain the weight. And this is a phenomenon that everybody's seen in athletes who tend to be in very good shape during season, and when they're out of season, they get very out of shape. Again, it's a direct effect on the appetite thermostat. Another thing that can affect the appetite thermostat is emotional trauma. Okay, and this is kind of interesting. We've all seen people who have lost family members, spouses, children, or parents, and they just feel terrible and they don't want to eat at all, and they just lose weight like crazy. Other people, when they get under physiologic stress and emotional stress, they put on the feed bag and gain a lot of weight. So again, emotional trauma can affect the appetite thermostat in both a positive and a negative direction. And finally, the appetite thermostat can be lowered by certain medical diseases, particularly cancer. It's kind of interesting. If you had cancer of the bone in your leg or something like that, it wouldn't have anything to do with your stomach, but if that was getting big, your appetite would go and you'd lose weight, even though nothing would be wrong with the stomach or digestive tract in general. So when you put all of these 5 things together that affect your appetite thermostat, there's really only 2 ways that an individual is going to take weight off and keep it off, and that is, number 1, affect stomach stretch, and number 2, regular aerobic exercise. These are the only 2 things that are practical. Clearly, you don't want to undergo emotional trauma to lose weight or get sick from another cause, and if you're past puberty, it's too late. There's really nothing you can do. Now, it's kind of interesting. If you look at the number of calories that an individual needs to eat just to maintain weight, not gain or lose, it's interesting. If you look at a 20-year-old male who's relatively active, that person will have to eat 2,500 calories per day just to maintain weight. A 20-year-old woman who's not quite as active, doesn't have as many muscles, she may only need to eat 2,000 calories to just maintain weight. But as you get older, your activity goes down and your metabolism goes down, and you'll notice that just to maintain weight, you can only eat fewer and fewer calories. And if you look at an average 40-year-old man, it's 2,000 calories per day. A 40-year-old woman who's relatively inactive may get by with as little as 1,800 calories. And as you get up into the 60s, you know, you take a 65-year-old woman here, can really get by fairly well with 12, 13, 14, 1,500 calories. You know, that's not a lot of calories just to maintain weight, not gain or lose. When you look at it, there's actually 2 kinds of food we eat, and I actually sort of learned this inadvertently from a patient of mine at Myrtle Beach Air Force Base. So when I was an internist there back in 1982, it was kind of interesting. I had this patient who came to see me in my clinic who was complaining of 3 things. She said she was recently diagnosed as having high blood pressure. Her back was really killing her, and the other thing was she was noticing that she was really getting short of breath whenever she went up and down steps. Now, this woman was a very successful businesswoman. She owned her own motel there in Myrtle Beach. She was very intelligent, you know, and I checked her out, and I could have taken the approach, well, I could give her blood pressure medicines, arthritis medicines, and breathing medicines to handle these 3 complaints she had. But when I looked at her, she was 5 foot tall and weighed about 205 pounds. And I said, ma'am, all I think you need to do is lose a few pounds and all this will go away. And she said to me, Dr. Whitney, I've been on every diet in the world and I just cannot lose weight. I mean, nothing I do, I just can't lose weight. And I said, well, I've got a diet that you'll lose weight on if you'll stick to it. And I put on a very low-calorie diet, 700 calories a day, high protein, you know, mineral supplements and all that sort of stuff. And I saw her every week to check her to make sure it wasn't having any adverse effects on her health or electrolytes or metabolism. And it's kind of interesting. She comes back a week later and she is ecstatic. I mean, she's happy as she could be. She had lost 10 pounds and she says, Dr. Whitney, I can't believe it. You know, I have never been able to lose weight and this diet really works. And I says, well, keep it up. Let's see where we get. You know, and she was on it for another week and she comes in, you know, 5 pounds down. Again, ecstatic, but, you know, not as happy as she was that first week with the 10-pound weight loss. And it was really interesting. With just that 15 pounds of weight loss, her blood pressure totally normalized, you know, and her back pain was gone. I kept her on the diet for another 3 weeks. She lost another 4 pounds. She was just so happy. You know, now she could go up and down steps. Her blood pressure was normal. Her back pain was gone, and she was happy. And she says, well, Dr. Whitney, can I continue this for another week? Because I'd really like to get into some dresses that I used to own. You know, and I says, well, you know, about 1 more week is all I'd really like to do on this kind of a diet. Fine, let's go for another week. Well, she comes back the next week virtually in tears. She hadn't lost a single pound. And I says, well, ma'am, I says, you know, did you cheat on your diet? And she says, well, Dr. Whitney, I have to be honest with you. You know, the most dangerous place to be in Myrtle Beach this last week was between me and Wendy's, you know, at about 9:30 at night. Said, I just got so hungry, I jumped in my old Cadillac and I just went on down the road, you know. And man, I'd have run anybody over who tried to get in between me and that food, you know. Well, it was really kind of interesting. I says, well, kind of what did you get? And she says, well, Dr. Whitney, I got a taco salad, you know. But that's all I got, you know. And I says, well, did you use any salad dressings on that taco salad? She says, well, sure, Dr. Whitney. You know, I really like that, you know, that Italian oil and vinegar stuff. And I just, you know, put, you know, 4 or 5 of those big bowls of salad dressing on there. Well, I sat down and did an analysis of what she actually ate. There's about 3 ounces of cheese in a taco salad, and that's got around 350 to 400 calories in it. There's 3 ounces of hamburger. Again, that's over 300 calories. And with all this oil that she put on her salad, I figured that she got about 900 calories there. And in this small volume of a taco salad, she probably got 1,800 calories. You know, and I looked at that and I said, well, holy smoke, here she is, she's starving herself all day on this 700 calories, she's miserable all day, and then she gets real hungry, and then just in about 5 or 10 minutes, she puts away 1,800 calories, totally undid all the good that she did that day and all the good that she did the previous day, and that's why she didn't lose any weight. And the bottom line, her problem was not that she ate a whole lot, it's that what she ate had a tremendous number of calories in them. In other words, there's high-test food, and when I'm referring to high-test food, I'm talking about food that has a lot of calories per bite, whereas regular food, you know, low-test food, has very few calories per bite. Now, this brings into the concept of caloric density, you know, the number of calories per bite. If you're eating food that has a lot of calories per bite, you will never get any stomach stretch out of that kind of food. So many calories in a small amount. Whereas if you eat foods that contain very few calories per bite, that will stretch your stomach and shut off that thermostat in your brain. And that's why the critical thing for weight loss is to eat foods that cause stomach stretch and actually decrease that thermostat. Because I'll tell you one thing, if that thermostat is on and says, I'm hungry, feed me, you cannot ignore that call very long. You will eventually cave in, and this is why the vast majority of weight loss programs that push small portions are total failures. They just don't seem to work in the long run. Yes, 2 months, 3 months, 6 months, maybe a year, but you watch people 2 years later, virtually all of them are right back at the same place. The only thing that will really work is to lower that stomach, is to raise that stomach stress, lower that thermostat, or exercise regularly. Now, if you compare the stomach stretch from the amount of calories in hamburger and fish, you'll notice that there's about 5 times as many calories in hamburger, bite for bite, in hamburger than there is in fish. And again, fish will really win this battle any day. If you take a look at the difference in stomach stretch between bacon and boiled shrimp, you'll notice something very dramatic. If you eat just 3½ ounces of bacon, you would have to eat over 1.5 pounds of shrimp to get the same amount of calories, as long as the shrimp is boiled. Again, virtually no stomach stretch with bacon, and again, very difficult to lose weight eating bacon if weight is a problem for you. Again, it's really high in calories. It's kind of interesting. How many people like to snack on cheddar cheese? Well, you know, I ask this to a group of patients all the time, and everybody's hand goes up. That's me. I love cheddar cheese, or I love Swiss. You know, in just 3 ounces of cheddar cheese, you're talking about 400 calories of food. You know, if you were to snack on asparagus, you know, which has 25 calories in 3 ounces, you would have to eat about 3 pounds of asparagus to get the same amount of calories from eating just 3 ounces of cheese. Now, what would happen to you if you tried to eat 3 pounds of asparagus? Well, your jaw would get tired or your stomach would bust, you know, and shut off your appetite thermostat. Again, if you're hungry and you have a weight problem, don't eat high-test food, because really you'll gain so much weight before you have any effect on your appetite thermostat, and you cannot beat it. I mean, the worst thing that you can do is to be really hungry and around a lot of high-test food, as this guy is here. This guy's in a feeding frenzy. And again, you know, if you get hungry, you know, and you need to snack, make sure you snack on food that doesn't have a lot of calories per bite. Now, it's kind of interesting. If you look at regular ice cream versus the new non-fat yogurts, which are artificially sweetened with Equal or NutraStreet, you'll know a tremendous difference. If you just eat, have 7 ounces of regular ice cream, it turns out that you'd have to eat almost a half a gallon of the new special yogurt, the non-fat, artificially sweetened yogurt, to get the same amount of calories. Well, it's very easy to get 7 ounces of ice cream in you. I want to tell you something. It tastes good and it doesn't stretch the stomach. But I tell you, there's hardly anybody that I know that can sit down and eat a half a gallon of yogurt at a sitting. Your stomach will bust before you really get into any kind of trouble. You know, this slide just shows you the differences between skim milk, buttermilk, low-fat milk, and whole milk. Again, low-fat milk is really not low in fat at all. You know, in fact, a skim milk is really what you want to drink if you have a weight problem or a cholesterol problem. And right here, you can see the cholesterol content of skim milk is relatively low, you know, clearly compared to low-fat milk and regular milk. And again, buttermilk, you know, the 1% butterfat is actually pretty good. Then you come up here to calories. Again, you can see skim milk is much better than low-fat milk, or particularly whole milk. You look at the saturated fat, that's the worst stuff in the diet. Again, skim milk extremely low in saturated fat, but again, low-fat milk is not really low at all. It's just lower than whole milk, and then this is the total fat content. And again, skim milk and buttermilk, the 1% buttermilk, are clearly superior to the low-fat and the regular milk. It's kind of interesting. What happens when you fry? Well, if you take 3 ounces of fried shrimp, you know, it turns out it has 4 times as many calories as boiled shrimp. You know, if you look at any kind of fried foods, the amount of calories per weight goes up absolutely tremendously, because oils have absolutely the most calories per bite of any food out there. 900 calories in just 3½ ounces. Again, if weight is a problem to you, or cholesterol is a problem to you, or blood pressure is a problem to you, you really absolutely need to get off fried foods. They just shouldn't be part of your diet. They just have too many calories, and they're bad kind of calories. This slide just shows you a little cartoon of a piece of pecan pie for dessert versus, you know, a fresh peach. And it's kind of interesting. If you eat, you know, a 9-10 ounce piece of pecan pie, which would be a large, you know, deep dish pecan pie piece, you'd have to eat over 5 pounds of peaches to get the same amount of calories. Well, I can tell you, you come around Thanksgiving and Christmas time, and that pecan pie is fantastic, you know, and there's always room for it, you know what I mean, and you can get it in you. Well, you know, it's obvious that you could not eat 5 pounds of peaches. Again, you know, these very high-calorie desserts such as pecan pie, the other pies and cakes and ice cream, you know, you just just are not going to lose weight or maintain a weight loss by eating them. They're just too rich, too many calories per bite, no stomach stretch. It'll just let your appetite thermostat go high, and you'll gain all the weight back. Here's another kind of simple snack. People like peanuts and pecan nuts. And again, if you just ate 3 or 4 ounces of pecans, I mean, which is very easy to do, you'll get, you know, an incredible number of calories in you. It turns out you would have to eat about 5 pounds of green beans to get the same amount of calories. Again, you cannot eat 5 pounds of green beans. Your stomach will fill up, your stretch will go up, and it'll shut down your thermostat for food, and then you'll stop eating automatically without having to feel hungry. And that is the critical thing. There's no two ways about it. When you reduce the total fat content of the diet and the sugar content of the diet, weight is tremendously improved. Now, a lot of people think beans, rice, and potatoes are fattening. They're actually not fattening at all. They only become fattening if you put a lot of margarine and sour cream on them. You know, you can flavor the beans and the potatoes and the rice with butter buds, Molly McButter, which have virtually no fat in them, or that non-fat yogurt, which is very low in calories, very low in fat. Again, you can get that good flavor without all the calories. Again, you just have to make those substitutions. And the bottom line is, to change weight, you've got to change foods. There's no way over a long period of time you're going to be successful with weight loss just by decreasing the number of bites. You can do it for a short period of time. You'll take off the weight. You'll feel miserable, hungry all the time, and with time you're going to crack and eat your way right back up to that original weight. You've got to reduce the percent of fat calories in the diet, get those low-test foods in you, the kind of foods that are good for you, the beans, the vegetables, the oats, the things that have no cholesterol, very low in fat, and the small amount of fat they have is a good fat, and again, full of fiber, vitamins, and minerals. You've got to change weight, to change what you eat, to lose weight and keep it off. Now, I think it's absolutely ridiculous to say, well, I'm never going to eat another piece of chocolate. I'm never going to eat another piece of cheese. I'm never going to eat, you know, another piece of bacon. I mean, nobody's going to do that. But I think what you have to do is make a commitment to your health several days a week. And what I usually recommend is Monday through Friday, be good to your body. You know what I mean? Eat the way you know you should, you know. And on the weekends, you can kind of, you know, eat more or less normally, because that's when you go see other people, and I guarantee you they're not going to be on a high, you know, a low-fat, low-sugar diet. They're going to be eating fairly normally. But if you make this commitment to your health Monday through Friday, you know, you will be very successful. One of the mistakes that a lot of people make is that they eat a healthy breakfast, a healthy lunch, and then kind of pig out on dinner. You know, you can totally undo a single day's dieting by one terrible meal. Again, that's why I stress, do this for several days in a row and get that benefit. And if you do this, I think that it's a reasonable compromise, a commitment to your health, and overall, you'll do better.